Okay, so first I am going to do hand hygiene, and then I will don gloves. So now I'm going to identify and inspect everything. So this is my primary tubing. This is the spike, which still has the cover on it. This is the drip chamber. This is the roller clamp, and this is the Y port, and this is the adapter end. I'm going to be putting the spike in this portion after I would open it. And then same thing, this is the secondary tubing, this is the spike, drip chamber, clamp, and end. And this is my labeled medication bag of 250 milligrams of amoxicillin in 100 milliliters of saline, and I'm going to be spiking this one once I take that portion off. Okay. So now I'm going to spike this bag. So I'm gonna take that off. Okay. And then I'm going to, sorry, I should have clamped this beforehand, but it's okay. I'm gonna fill the drip chamber 1/3 to halfway full, and I would then hang it. So now I'm going to, when I would hang it, I would make sure it's 30 inches above where the patient's IV is inserted. And I am going to prime the tubing by opening the roller clamp, and I'm going to open this and drip it into a trash receptacle. So once I get the drops in there, I'm going to close it, and then I'm going to look and make sure there's no bubbles. Okay. And this is closed now. There's no bubbles in the tubing, so then I would have, I'm going to connect the catheter end, making sure that it hadn't touched anything, to the patient. I'm going to say that this is the patient. Then I'm going to regulate the drip rate of the IV tubing. So the drip factor for this tubing is 15 drops per milliliter. And the order was for 150 milliliters of saline, so I did 15 drops per milliliter times 150 milliliters divided by 60 minutes, and that gave me 38 drops per minute. So now I'm going to count the drip rate. First, I'm going to count for about 15 seconds and watch the drip and make sure it's between 9 and 10 drops per 15 seconds. And then once I've got that accurate, I'm going to count for a full minute to get the 38 drops. Okay, so I've got it to between 9 and 10 drops per 15 seconds. Now I'm going to count for a full minute and make sure it's 38 drops per minute. Okay, I got 38 drops in a full minute. So now, sorry, I'm going to pretend that's in the patient. So now I'm going to ask my patient if they have any allergies, and I'm gonna make sure that that allergy, if they do have allergies, it doesn't interfere with the medication that I'm giving. So I have verified that he does not have an amoxicillin allergy. So now I am going to verify the 6 rights of medication. That means I'm going to make sure that this is the correct patient, correct medication at the correct time, through the correct route, the correct dose, and afterwards I would document correctly. So now I'm going to spike this bag. So I'm going to, again, I've verified this is the correct medication. I'm going to close the roller clamp. Then I'm going to remove that, put it in the trash can. Okay, and I'm gonna squeeze this, make sure it's 1/3 to halfway full, and I would hang it, the piggyback would be above the patient, or sorry, excuse me, above the primary infusion. Then I'm going to prime the tubing. I'm going to open and drip into a trash receptacle. Okay, then I would maintain a septic technique, and now I'm going to connect this to my patient. So I'm going to get an alcohol swab, and I need to use the alcohol swab on the Y port of the main infusion. And then I put that in the trash. I would let this dry before connecting my secondary tubing. To the Y port. And once that's connected and it's connected to the patient, I'm going to regulate the flow of the secondary or the piggyback, which is also, the drip factor is 15 drops per milliliter, and the order called for 100 milliliters, so it's 250 milligrams in 100 milliliters of saline. So I would do 15 drops times 100 milliliters divided by 15 minutes, because they wanted it over 15 minutes of time. That would give me 100 drops per minute. So I'm going to do the same thing, and I'm going to count for 15 seconds and get 25 drops. And once I've got that regulated correctly, then I'm going to count for the full minute to get 100 drops per minute. So I'm going to make sure it's the correct one and open the tubing. Okay. So I'm going to count for 15 seconds. Okay, I've got it to 25 drops in 15 seconds, so now I'm going to count for the full 60 seconds to make sure it's 100 drops. Okay, I have counted for a full minute and I verified that it is 100 drops per minute.